Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. Inflammation is at the root of many chronic conditions, from asthma to arthritis or Alzheimer's. Where is the inflammation coming from? This is the People's Pharmacy with Terry and Joe Graydon.
Biologist Paul Ewald has developed a new theory explaining the origins of many of our most devastating chronic diseases. Conditions as diverse as Alzheimer's, cancer, gingivitis, heart disease, and schizophrenia might have infection as a common denominator.
Should we be treating the underlying infectious causes of these conditions as opposed to trying to suppress the symptoms? And what about prevention? Could vaccines keep us from developing some cancers in the first place?
Coming up on the People's Pharmacy, the new germ theory behind so many difficult-to-treat diseases.
First, this news.
In the People's Pharmacy health headlines, statin-type cholesterol-lowering drugs may increase aggression in postmenopausal women. That's the finding of a new study from the University of California, San Diego. The research was a randomized controlled trial designed to look at behavioral changes. It included more than 1,000 adults put on simvastatin, pravastatin, or placebo for 6 months. The participants kept detailed diaries each week, and the investigators counted actual aggressive acts towards others, self or objects. They also measured sleep problems and testosterone levels. Men and women were randomized, and their results analyzed separately. The researchers found that statins resulted in increased aggression in women over 45 years old. Those who were least aggressive at the start had the greatest increase. Statins had the opposite effect for most men. That may be due to the lower testosterone levels they experienced on statins. There were, however, 3 men whose aggressiveness increased dramatically while on these cholesterol-lowering drugs. The lead author, Dr. Beatrice Golomb, suggests that statins don't affect all people equally. According to Dr. Golomb, either men or women can experience increased aggression on statins, but in men, the typical effect is reduction.
Tart cherry juice has anti-inflammatory properties and may help athletes recover faster from intense exercise. British investigators found that if marathon runners drank tart cherry juice every day for 5 days before a race, on the day of the race, and 2 days afterwards, their inflammation levels were lower than runners drinking placebo juice. In addition, runners drinking cherry juice did not develop upper respiratory tract infections such as sniffles or cough after the race. About half of those on placebo juice did suffer such complications. The researchers suggest that Montmorency cherry juice may enhance recovery from intense exercise.
The insecticide Lindane has been marketed as a lice shampoo for decades. Dermatologists used to assume that it was not absorbed into the body and that it was safe for children. A new report from the World Health Organization's International Agency for Research on Cancer has categorized Lindane as a human carcinogen. In particular, animal research and epidemiological data suggest that there's an increased risk for non-Hodgkin lymphoma. Although there are no specific studies proving that topical application, such as lice shampoo, boosts the chance of developing this dangerous cancer, it would seem prudent to limit children's exposure to this cancer-causing chemical.
Diagnostic error may be far more common than most people think. A new study estimates that up to 12 million Americans don't get the correct diagnosis when they visit their doctor's office. The researchers analyzed 3 previous studies of outpatient diagnostic errors. They discovered a 5% error rate, with up to half of the errors carrying the potential for serious harm for the patient. That means as many as 6 million adults could be harmed annually because of diagnostic errors. This study did not take into account mistakes in diagnosis that occur in hospitals or nursing homes. Some previous studies have suggested that diagnostic error rates in such institutions may be substantially higher. Lack of a correct diagnosis means that many patients don't receive the appropriate treatment for their condition. In cases of cancer, delay can be lethal.
A large survey of patients and their families sought feedback on healthcare harm. The Safe Patient Project, sponsored by Consumers Union, recruited patients online. They answered questions about surgical procedures gone awry, healthcare-acquired infections, and problems with medications, including overdoses and inappropriate medicines. Misdiagnosis was the most commonly reported problem, occurring in nearly one-third of the reports. The analysis noted that a perceived lack of accountability and poor communication on the part of both healthcare providers and healthcare systems contributed to these harms. The consequences included a lack of trust, as well as profound suffering, financial, emotional, and physical. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Inflammation is recognized as the primary cause of many chronic conditions, from Alzheimer's disease and arthritis to asthma and inflammatory bowel disease. But what causes the inflammation? Could infectious agents be the root of most of our chronic diseases, including cancer?
We're talking today with Dr. Paul Ewald. He is professor of biology and director of the program on disease evolution at the University of Louisville. We're talking about two of his books, Controlling Cancer, a powerful plan for taking on the world's most daunting disease, that is available as an ebook from TED Books, and his previous book called Plague Time, the new Germ Theory of Disease. Welcome to the People's Pharmacy, Dr. Ewald.
Well, thank you for having me. It's nice to be here.
Dr. Ewald, when we interviewed you many years ago, you turned a lot of our listeners upside down with the idea that the germ theory, which has been around now for quite a long time, could be responsible for so many of our chronic conditions. We often don't think of it that way. So let's just go back and count up all of the possible chronic conditions that might in some way be associated with infection.
Well, I think we have to subdivide those diseases because some of them now are accepted as caused by infection. When we last talked, it was just the beginning of the time in which people were accepting cancers as being caused by infection. And that's probably the most dramatic change. When we talked, most people were surprised to hear that the evidence suggested that cervical cancer, for example, is caused by infection. And now that's become commonplace in a fairly short period of time, largely because a vaccine has been developed to prevent the infection with the virus that causes cervical cancer. Since that time, we found the same virus in many other tissues. And so even if we just look at a small subset of the cancers, now we've accepted not only that cervical cancer is caused by human papillomaviruses, but also rectal cancer, penile cancer, cancers of the head and neck, such as tonsillar cancer, and we're finding this virus in other cancers for which we don't understand the causes yet, but cancers for which this virus may actually play a causal role. So, cancers such as breast cancer and cancers of the esophagus.
Now, before we go much further, there are two things we need to establish. One, that you don't catch cancer from someone else. The idea that, someone you love has cancer and now maybe you could catch it from them. That's been around for a long time. People worry about it, but that's not what you're talking about.
No, not exactly. What we're saying is that infections are much more common causes of cancer than people had thought, and they may be even more common than most people think today. But the important thing to remember is that all of these infections that are linked with cancer or suspected to be causing cancer are infecting far more people than the number of people that would be responding to that infection by having cancer. So cancer is a side effect, and it's a fairly rare side effect of infection. So for every 100 people who might be infected with these particularly cancer-causing strains of human papillomavirus, we may have only 1 to 5 that are actually coming down with a cancer. So you catch the infection actually takes over cells in a very disturbing way, which pushes them towards cancer but doesn't necessarily cause cancer. And then once they're pushed towards an unregulated growth, then additional mutations may actually finish the job and cause cells that are not behaving normally because they're replicating too much to go all the way to a cancer.
Well, in fact, there was a recent announcement from the International Agency for Research on Cancer that approximately 16% of cancers worldwide are caused by preventable infections, including HPV, which is human papillomavirus, the one we're talking about with cervical cancer. They also mention hepatitis C, which is another viral infection that may be associated or seems to be associated with cancers. You're saying 16% might not be high enough?
Oh, yes. Well, those figures are the figures that people now accept. But what they're not saying in those articles is what proportion of all cancers we really don't understand very well. And those cancers may also be caused by preventable infections. We just don't have enough information yet. So we can say that about 25% of all human cancers are caused by infection, and about 15% of those infections are preventable. But we also we really should quickly add in that about 80% of cancers, almost 80%, are caused by uncertain causes. Certainly they're caused by something, and infections may play a role in most, maybe mostly all of them. We just don't have enough information yet to say what the full scope of infectious causes of cancer are. But we do have enough information to say that some of these cancers are caused by infections that we can prevent either by interfering with transmission or by vaccination. One that you didn't mention was hepatitis B virus, and that's a very good example of a virus that's accepted as a major cause of liver cancer, maybe some other cancers as well, maybe some other chronic diseases as well. And that virus we can prevent from infecting people by screening blood supplies, but also by the hepatitis B vaccine.
We're going to come back to the idea of controlling cancer, either through prevention, perhaps with vaccines, or effective treatments. But first, let's return to the idea of chronic conditions caused by infection. There are so many, we've almost lost count. But let's go ahead and consider some of the most common conditions that people suffer from. Okay.
So we have chronic conditions that we know are caused by infection, most of which have been accepted as caused by infection in the last 20 years or so. Things as simple as gingivitis and periodontitis. We have other chronic conditions that are causing a lot of problems that may be caused by infection. We've got infectious agents, right, where we've got damage, things like sporadic Alzheimer's and cardiovascular diseases.
Wait a minute.
Alzheimer's?
Sporadic Alzheimer's disease.
What's sporadic about Alzheimer's disease?
Okay. That's right. Well, people subdivide Alzheimer's diseases and many other kinds of chronic diseases according to the known influences of genetics and environmental factors. And so for Alzheimer's disease, minority of the cases are clearly caused by genetic predispositions. We have identified these genetic mutations, essentially.
People with an ApoE4 gene.
Well, ApoE4 is just a little different. That would be included as a predisposing factor for sporadic Alzheimer's. So basically, sporadic Alzheimer's means Alzheimer's that doesn't really run in families very well. And then we could say that the strongly genetically based Alzheimer's are familial Alzheimer's. These are the kinds of conditions that you'd be more likely to have if your family members had them. Now, those are often talked about as though they're distinct categories, but the dividing line isn't so clear. And Terry, you mentioned one of the examples of how that dividing line is a little blurred. So for the non-familial Alzheimer's, the sporadic Alzheimer's, there are still genetic predispositions, as there are for virtually all chronic diseases that have been well studied. At least we know the genetic predispositions for many of them. And one of the genetic predispositions for sporadic Alzheimer's or non-familial Alzheimer's is this gene that many of us are carrying. In America, about 10% of us are carrying this gene, or it's technically an allele. It's a variant of a gene that's called the epsilon 4 variant. And that variant has been known now for about 15 years to predispose people to Alzheimer's. But the exact mechanism wasn't clear. In fact, when we last talked, the mechanism wasn't clear. But now it looks like the mechanism is, at least in part, that particular genetic variant predisposes people to an infectious agent that is associated with Alzheimer's, but also with other chronic diseases that are linked to the epsilon 4 variant, such as atherosclerosis and multiple sclerosis. So all three of those diseases are linked to both the epsilon 4 allele and chlamydia pneumoniae infection. The exact mechanism is still being argued. Even the role of chlamydia pneumoniae has people vociferously arguing on one side or the other. But there's data that suggests that this bacterium actually hitches a ride into our cells by latching on to this epsilon 4 protein and exacerbates these problems in that way.
Now, we've heard about this bacterium before, chlamydia pneumoniae. Associated with asthma. And if you want to get a bunch of pulmonologists very excited very fast, you say, oh, yeah, we've heard that there may be an infectious component to asthma. And they go, no, it's an inflammatory condition. It's allergic. What about a bacterium and asthma?
Well, this issue of asthma raises a much more general issue that if people understood it, we would be less surprised by these new developments. And that general issue is that we find a little part of a cause, of a condition, and then somehow our mind's curiosity just ends up sort of being terminated, right? And so what happens is you find out that inflammation plays a role, and people say, oh, it's an inflammatory disease, end of story. But for me, that's the beginning of the story. I want to know what causes the inflammation, because as an evolutionary biologist, I realize that if people had immune systems that just sort of went crazy frequently and thereby made people less able to function, that vulnerability to illness would be weeded out by natural selection. So there has to be something else that's actually pushing the immune system into a corner, and one of those things looks like it's infection, which actually triggers inflammatory responses and can cause the progression of the disease.
You're listening to Dr. Paul Ewald, Professor of Biology and Director of the Program on Disease Evolution at the University of Louisville. His books include Controlling Cancer, which he wrote with Holly Swain Ewald, and Plague Time, the new germ theory of disease.
We need to take a short break. When we come back, we'll learn more about chlamydia pneumoniae and its consequences. Could it be responsible for a lot of chronic conditions like heart disease or even asthma?
What is the connection between inflammation and infection? Could there be a benefit to inflammation?
And could infectious agents have a role in some other chronic conditions beyond Alzheimer's disease, such as diabetes, arthritis, and multiple sclerosis? And if so, are there some other ways that we should be treating these conditions? Should we be using antibiotics?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like the information you hear when you listen to The People's Pharmacy, you may also enjoy our book published by National Geographic. It's The People's Pharmacy Quick and Handy Home Remedies, available online at peoplespharmacy.com or at your favorite bookstore. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible by Red X Industries, makers of Utter Cream and Utterly Smooth Extra Care Cream enriched with urea to moisturize dry, cracked skin. 800-345-7339 the website uddercream.com.
And by We Patients, where you can learn from others about possible triggers and potential treatments for your headaches or migraines online at wepatients.com.
If you'd like to order a CD of this show, you can call 800-732-2334. It's show number 906. That number again, 800-732-2334. Or find it on our website, peoplespharmacy.com.
The idea that infections could be the source of many diseases like cancer, diabetes, or Alzheimer's disease seems radical, and yet there's growing evidence to support this approach. If inflammation in the body is responsible for so many chronic conditions, including heart disease and asthma, doesn't it make sense to look for the source of the inflammation and treat it?
We're talking today with Dr. Paul Ewald. He is a biologist, a professor of biology, author of Plague Time, The New Germ Theory of Disease, Controlling Cancer, a Powerful Plan for Taking on the World's Most Daunting Disease, and director of the program on disease evolution at the University of Louisville.
Before the break, Dr. Ewald, we were talking about this bacterium called Chlamydia pneumoniae, and the fact that it has been linked with a number of conditions, including possibly atherosclerosis or heart disease, but also asthma. When I've talked to pulmonologists about the asthma connection and the idea that the way asthma is treated these days is primarily with inhaled corticosteroids, they say, well, yeah, that's the gold standard. That's what we do. It's sort of like the idea of treating poison ivy with steroids for weeks, months, and years, and no dermatologist would ever do that because the root cause is the poison ivy. You want to stay away from that nasty plant. How do we get rid of the Chlamydia pneumoniae that might be behind some of these inflammations, these inflammatory diseases?
Well, Chlamydia pneumoniae is susceptible to antibiotics. So when we realize the scope of diseases that Chlamydia pneumoniae causes, then I think we can be more vigilant at identifying infections when they first occur, treating them so they don't become persistent. So I think once we understand that a disease is caused by infection, then that should make us more interested in routing out those infections right at the outset, trying to prevent them so we can prevent the chronic diseases that occur later on. Medicine is very good at dealing with infectious diseases. The problem has been that medicine has often been very slow to recognize infectious causes of diseases that people have ascribed to other factors. So with regard to asthma, we certainly know that inflammatory responses are important. I would ask, are the inflammatory responses triggered not just by environmental, non-infectious factors, but also are they perhaps triggered or instigated by infections that throw the immune system off? And so if the answer is that infections are playing a role, it's actually quite dangerous to be treating these conditions with anti-inflammatories because we're really treating the symptoms. And if the cause is actually infection, the anti-inflammatories can suppress a process that is controlled by inflammation. Inflammation actually is a defense. It's just when it gets exaggerated, it gets thrown out of kilter, that it causes a net problem. So then just going back to the poison ivy, I would feel more comfortable with treating poison ivy with anti-inflammatories like corticosteroids than I would something like asthma, although I think it's very clear if asthma is very serious, you do have to get in there and do something. The immune system may have been knocked out of kilter, and at that point you have no choice but to treat. But with poison ivy, it's pretty clear it's probably a manipulation of our system so that we don't trample or eat those plants. And so we have to be aware that any manifestation of any disease, any symptom, could be a defense by us against the causal agent, or it could be a manipulation of us by the causal agent. And if it's a manipulation, we would want to treat the symptom. If it's a defense, we don't, because we'd be sabotaging a defense.
I'd just like to have you clarify that the chlamydia you are talking about is not the one we think of as a sexually transmitted disease, although obviously that's also a serious infection.
That's right. In fact, now many people who design the naming of these organisms have divided these two kinds of chlamydia into entirely different genera. But it is important to realize that the sexually transmitted chlamydia, which is referred to as Chlamydia trachomatis, is really a very different bacterium. And that can be transmitted sexually. It can also be transmitted, at least occasionally, into the conjunctiva in the eye, so you can actually get inflammation in the eye, which is referred to as trachoma, and that's how it gets the name chlamydia trachomatis. But this chlamydia is transmitted almost entirely by the respiratory tract. It's transmitted by people coughing, and then other people inhaling a contaminated droplet, and then this bacterium infects cells that are in the linings of the lungs. One of those cells are the macrophages, which are the white blood cells that gobble up invaders. And then those macrophages, instead of being able to kill the chlamydia, actually provide a home for the chlamydia. They are able to avoid destruction inside of those white blood cells. And those white blood cells go everywhere in the body. And that's how the chlamydia can be transported to various sites in the body and cause systemic damage and chronic disease.
Well, you've really got me intrigued now, and I'm very curious about the link between infection and inflammation. And from an evolutionary perspective, what is the animals? I assume all animals respond then if we do to infection with inflammation. What's the advantage?
Well, inflammation is a process in which you're bringing really the army of infection-fighting cells to the site of the infection. And so inflammation is one of the most fundamental defenses against infection. And that's the reason it's here in us and most every other multicellular organism, at least that have a vertebrae column, is that it is very effective. Without it, we'd be in real trouble. And if you can learn a little bit about this problem by looking back in history. When cortisone was first introduced, people started applying it to all sorts of disease situations, and for the first few days of treatment, they thought it was a miracle drug. And then sometimes what they found is a patient that was, doing pretty poorly before the cortisone, and then seemed to be doing wonderfully for a few days, would die a few days later, okay? And so we know that these anti-inflammatories are generally to be withheld from acute infectious diseases. But now when we look at chronic diseases, the situation becomes a little more murky, because with chronic diseases, we know that some of the damage that we can identify is caused by the inflammatory response. The unknown question is, how much good is that inflammatory response doing in addition to the damage? So we may, I think, run into a situation when we really understand these systems well that involves a little bit more damage than good from some of these anti-inflammatory treatments, because the infections that may be underlying them will actually be able to cause more damage if the immune system is turned down.
So we've gotten three conditions, and I just want to go back, a little sidebar here. You've talked about this, did you call it intermittent Alzheimer's?
Sporadic.
Yep. So we have sporadic Alzheimer's, we have atherosclerosis and maybe heart disease, and we have asthma. Do you think all three of these conditions are indeed caused by or linked in some people, not everybody, to this bacterium, Chlamydia pneumoniae, and should we be treating with antibiotics in all three conditions?
Well, I think that the available evidence indicates that infections are playing a role, and this infection is playing a role in at least many of these cases. But if we look at any one of those diseases, we have to realize they're really a composite of a lot of different diseases. We just use a particular name because when we don't understand the causes, we've got to group diseases together to talk about them. And so we group them together according to symptoms. So, for example, with atherosclerosis, if you actually look at the lesions in the arteries of people who have this illness, you find Chlamydia pneumoniae, you find other bacteria. You find bacteria that are causing gingivitis and periodontitis. Not just one, but several of these bacteria. And it looks like these bacteria invade the blood system when there's maybe some injury in the mouth, even injury as slight as gum injury associated with brushing if a person has bad gingivitis, and then they can invade tissues in the rest of the body once they get into the bloodstream. So that's an example of how when we really understand these diseases, we're likely to find that many different factors are playing a role. My main point is that in consideration of the causes of these diseases, most experts have, for a very strange reason or set of reasons, neglected the possibility that infectious agents are playing a role. I think largely it's because people thought they understood what infectious diseases were, and then anything that looks a little different, people say, well, that's not caused by infection. But that error has been going on really every decade for the last 120 years. So what we can do is look in hindsight and see when people were making the errors, when people were arguing, for example, about rheumatic fever in the 1930s, 1920s, 1910, they were making the error that this disease doesn't look like an infectious disease. Other people saying, well, it's associated with strep throat. We think it's a sort of a new manifestation of the same infectious process. And then finally, that problem was resolved in the 1940s with the advent of antibiotics. You treated the streptococcal infections and you didn't get rheumatic fever. And so after 40 years of arguing,
how many years?
40 years. This argument began in the 1890s, and people would dismiss it saying, oh, yeah, there are these germ people that are trying to explain everything is caused by germ. And finally, after people developed what was seen as the critical tool, the antibiotics that could eliminate the bacterium, there was enough evidence. It didn't prove that the bacteria were causing rheumatic, but there's enough evidence that most sensible people said, well, this is by far and away the best explanation. And that process has been going on really every decade for the last 120 years. The kinds of diseases that people argue about change from decade to decade, but the common feature is that in every decade or every quarter century, the diseases that are accepted as caused by infection are caused by infection more cryptically than the diseases that were accepted as caused by infection in the previous decade. And so we always have to be changing our views of what infectious diseases are. And right now, I'd say the hottest area of this study is understanding infectious causes of cancer.
Dr. Ewald, you've just mentioned that every decade has had its arguments about which chronic diseases may in fact have an infectious origin. And we've been talking about atherosclerosis as possibly associated with chlamydia pneumoniae. That was something that actually was argued about quite a lot during the past decade. That's and right. The hypothesis was tested by treating people with antibiotics. And, hey, it didn't cure heart disease. Right. So what's going on there?
Okay, it's very important to look at what was being tested by what particular clinical study. And the studies you're referring to were looking at people with highly advanced stages of heart disease. These are people who may have had an infection for 50 years. And by the time they have that very advanced stage, if you look at the arteries are full of cholesterol and fatty deposits. If you look in there, you can still find chlamydia pneumoniae, but they're so covered with this covering that it's very unlikely that any antibiotic is going to be able to do anything. In fact, the people who are very well versed in this were saying at the outset that we should go ahead and try treating these people who have advanced stages of atherosclerosis with antibiotics. Maybe it'll have a positive effect, but it certainly doesn't test the idea that the illness was caused by chlamydia infections that may have begun 50 years ago. If people are treated with antibiotics in their 20s or 30s, maybe even in their teens, when the bacterium is more vulnerable, then you might be able to actually knock down the infection and prevent the heart disease. So all of these studies have been testing a different hypothesis. That hypothesis is, does antibiotic provide any benefit if you're giving it to people who are in very late stage of atherosclerosis disease?
So do you think if we were to treat people with antibiotics at the very first sign of some sort of brain inflammation that we might be able to actually reverse sporadic Alzheimer's disease or be able to cure certain people with asthma or perhaps even reverse atherosclerosis if we caught it early enough?
Well, it's worth entertaining that possibility. I think for a lot of these diseases, the damage has already been done and the bacterium is not so accessible to antibiotic treatment. It's worth trying, and that's what was done with many experiments, 10 years ago with regard to atherosclerosis. It turned out it had little, if any, positive effect. So I wouldn't bank on that. It's worth trying. If it works, that'd be fantastic. But I think the real solution here is to develop vaccines so that we can prevent those infections. And then also, if people take care of themselves to keep their immune systems up, rather than suppressing their immune systems, then they have a better chance of keeping those infections under control so that they won't be so invasive and they won't cause so much long-term damage.
Let's talk about some other chronic conditions that might be associated with infection. Rheumatoid arthritis, type 1 diabetes, schizophrenia, multiple sclerosis, just to name a few.
Right. Well, for every disease that causes big problems in our society, there are at least candidate pathogens. And some of the diseases that you mentioned actually have very good evidence for infectious cause and type 1 diabetes, for example. Now the evidence is very strong that there are viruses that are infecting various parts of our body, including the cells in the pancreas that are responsible for producing insulin. And those infections then keep our body from being able to produce an appropriate amount of insulin. And so under those situations, we need to have insulin injection. And those diseases we tend to group under the category of type 1 diabetes. Now, the fact that infection looks like it plays a strong role doesn't mean that the autoimmune processes that people often refer to are not playing a role as well. It seems pretty clear that for a lot of these diseases, you do have the immune system kicking in and causing some of the damage. But my main point is, let's focus on the most important parts of the process. If you can identify what the instigating factor is, it's far more important than identifying the exacerbating factors, because if you identify the instigating factor and you prevent it, you prevent the disease. And prevention is always better than cure, at least in terms of public policy.
Do we have any idea what the infectious agent might be for type 1 diabetes?
Right. Though group of viruses are enteroviruses that are implicated, and particularly Coxsackie virus. A particular kind of Coxsackie virus seems to be very important. Now, the data there's a lot of information that's available, but often people aren't looking very carefully at the information. And one of the most interesting studies on type 1 diabetes involved a researcher who had kept a kind of library of tissues from patients who had type 1 diabetes and died, and then has gone back to that collection and analyzed it for this virus. And a very interesting finding was that he found this virus in a vast majority of the pancreatic samples. And these were people who had had type 1 diabetes and already died. So they had had the illness for a year or more, and they still had evidence of the virus in the pancreas. So that suggests it's not just what so many people would like to believe or do believe, that it's a hit and run process where the virus gets in there, throws the immune system out of kilter, and then is gone, and then the immune system can't ever recover. It suggests that the virus is continually there, continually nudging that immune system, continually kind of throwing it off balance, and then as a result of the infection plus maybe the immune response, we're getting the damage to the critical cells, and then we get the disease that results from it.
You're listening to Dr. Paul Ewald, Professor of Biology and Director of the Program on Disease Evolution at the University of Louisville.
We're going to take a short break. When we come back, we'll find out about infections and mental illness. Is it possible that there's a link between schizophrenia and a common pathogen?
What about MS, fibromyalgia, or IBS? Why are people so resistant to this germ theory of chronic disease?
Could a vaccine be a model for conquering cancer? Vaccines to prevent many cancers might be more cost-effective than trying to treat them.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel soft and smooth. 800-345-7339. The website is uttercream.com.
and by We Patients, where you can learn from others about possible triggers and potential treatments for your headaches or migraines online at wepatients.com.
If you'd like to order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 906. That number again, 800-732-2334. Or find it on our website, peoplespharmacy.com.
Our topic today is the new germ theory of disease. Could infections be the cause of many of our chronic diseases that take such a toll in modern society, from cancer and Alzheimer's disease to diabetes and mental illness?
We're talking today with Dr. Paul Ewald. He is professor of biology and director of the program on disease evolution at the University of Louisville. He is an expert in evolutionary biology. His books include Plague Time, The New Germ Theory of Disease, and Controlling Cancer, a powerful plan for taking on the world's most daunting disease.
Dr. Ewald, we've alluded to some of the other chronic conditions that are perhaps caused by some sort of infectious process. Schizophrenia?
Well, when people think about mental illness, they usually don't think about infection, and that's very strange because the greatest success in the history of studies, medical studies of mental illness, has been identification of an infection that causes a mental illness. The infection is Treponema pallidum, and the infectious agent is Treponema pallidum, and the disease is syphilis. And so I would argue that we would certainly want to be looking at other severe mental illnesses to see whether they may be caused by infection. And the next most severe mental illness by most people's assessment would be schizophrenia. And if you look at the history of schizophrenia, it's really quite fascinating. The one disease organism that keeps popping up over and over again in many different studies is this protozoan called Toxoplasma gondii. And this is a parasite that's transmitted to people from cats, but also from undercooked meat. And now there have been 40 studies that have shown a very strong association between toxoplasma and diseases that most people would categorize as schizophrenia. And what's very interesting, in the last dozen years or so, there have been several studies of samples from women during pregnancy, and those samples has looked to see whether this traces of this organism or the response of the body to the organism is present during pregnancy, and then followed up the babies to see whether those babies develop schizophrenia. And those studies now quite uniformly are showing that mothers who had active infections with Toxoplasma gondii are more likely to have babies that eventually develop schizophrenia 15 to 30 years later.
I was going to say this has to be a long-term study.
Long-term study,
because the average age diagnosis of schizophrenia has got to be around 20 or 25, right?
That's right. So what people do is they look at tissues that have been banked, mainly blood, that's been stored, that was taken at the time of pregnancy and then stored for decades. And then now we can go back to those banked tissues, look for the presence of schizophrenia, and then find those babies that were born to those mothers and see if they have a higher frequency of schizophrenia.
And this is why pregnant women have been advised not to clean the kitty litter when they are pregnant. Get somebody else to do it.
Actually, it's a reason why I think we should advise pregnant women not to clean the kitty litter. But that advice has been largely on the basis of other negative effects of Toxoplasma gondii, and those negative effects include miscarriages and birth defects. And so it looks like now we probably are going to have to add increased probability of developing schizophrenia to those other two fairly grave, very grave, I would say, consequences of Toxoplasma infection. And I would also argue that this is really the right time to be making a big push for developing and provisioning of Toxoplasma vaccines. We have some Toxoplasma vaccines that have been shown to be effective experimentally, but and then we also have some drugs against Toxoplasma that have been shown to be effective. So I think we really need to develop those. Now the evidence is so strong that there are negative consequences of this. We need to get the information out to people to avoid exposure, and then we also need to develop vaccines and antitoxoplasmal drugs that can help remedy some of this problem. The problem may be even bigger. I mean, we don't, all we can tell is what the minimal scope of the problems are. Until we look hard, we may not really know that the scope of these infectious problems are far greater than anyone thinks.
What about multiple sclerosis, chronic fatigue syndrome, inflammatory bowel syndrome?
Yeah. Well, every one of those conditions has infections associated with it. But for each of those three conditions, it's not clear exactly what is going on in terms of cause and effect. For inflammatory bowel disease, it's clear that antibiotic treatment helps. And so that, to me, is a smoking gun for infection. What the actual infectious causes are, it's not clear. People are arguing about the possible role for a variety of different bacteria. I suspect it will probably be a variety of different bacteria that are playing a role. Multiple sclerosis, for that condition, the state of knowledge is somewhat similar. But I think there, I would put money on chlamydia pneumoniae at least playing some role based on the association with epsilon 4 and the association between chlamydia pneumoniae and epsilon 4. But other viral causes have been suggested. For a disease like rheumatoid arthritis, we just don't really know what the triggers are. We know the immune system's knocked off balance, but it's just something we need to have a lot more work.
One final question on this topic. We frequently hear from people who feel frustrated because there is no smoking gun. There was a long time in the South when people just didn't believe Lyme disease was in this area, and it was like, no, you couldn't possibly have Lyme disease. And then, oh, well, maybe there is some Lyme disease down here. And so the idea that, people have become infected by something, it makes some doctors crazy, and it makes some patients even crazier. Why is there such resistance still to this day that infectious agents could be responsible for so many chronic conditions?
Well, I would answer that question by a sort of circuitous route. I would say that if a person's feeling frustrated that the possibility of infectious causation is being ignored, sit back and relax a little bit, because it's the same frustration that people have been feeling for 120 years. It's always been this way. Whenever someone suggests that infection may be causing a disease, that a large proportion of the status quo will be rejecting the idea and calling it silly. And so I think that people just need to use their heads and realize that the pattern that's occurred for the last dozen decades has been an ever-increasing proportion of diseases being accepted as caused by infection. And so it's just human nature on part of some humans to reject an idea, and we just have to realize that that's often the case if people don't have the answer. And so we recognize that that is a failing of human nature, and we move ahead and actually try to test these ideas scientifically and find out whether, in fact, a putative agent really is involved in the disease.
Well, I'd really like to turn to the topic of your most recent book, Controlling Cancer, A Powerful Plan. Tell us a little bit about this powerful plan.
Well, I am a strong advocate of understanding a situation, and once you understand a situation well, then often the ways in which we can control the problem become apparent. And I think that's actually the case with cancer. We haven't understood the causes of cancer very well for most of the history of medicine. Now we're beginning to understand that a substantial portion of cancers are caused by something that we really can control. In particular, I'm talking about infectious agents. We know already that we've known for over 50 years that some cancers are caused by environmental factors, such as exposure to ultraviolet light with skin cancer, or exposure to carcinogens in smoke, in the case of smoking tobacco. And one would think that knowledge could lead to the prevention of a vast majority of these cancers. And in spite of the fact that these factors are playing an important role in causing cancer, it turns out that people are engaging in activities that cause cancer because they like to engage in those activities. People like to smoke, and it's very hard to change behavior. It's very hard to change smoking habits. It's hard to change people's tendency to want to go out in the sun and get suntans. So interestingly, although that's a clearly identifiable cause, we haven't had as much success as we might think we would have had in preventing those cancers. But part of the reason is that it's hard to change behavior when you have to change it sort of day in and day out. One of the very encouraging aspects of identifying infectious causes of cancer is you may not have to change the behavior day in and day out. It may be that for some of these infectious causes you can make a vaccine, and the vaccine can protect a person for years or maybe even the person's whole life against infections that can cause cancer. So it's much easier to imagine preventing cancers if you just have to get people to go in and get a vaccine rather than every day of their life change something that they would otherwise want to do.
Well, of course, if we could identify the infectious agent that were responsible, for example, for, let's just say, lung cancer, if that were the case, or for colon cancer, then we have to come up with a vaccine.
That's right.
And so we've been talking a lot about chronic conditions that may be caused by infectious agents, but we don't have very many effective vaccines for these viruses, like chlamydia pneumoniae, for example.
Which is not a virus.
It's a bacterium.
Which is a bacterium.
That's right.
But whether it's a virus or whether it's a bacterium, we're lacking in the kinds of vaccines that you're advocating for.
Right. But recognizing that these infectious agents may be playing a role in these very important diseases is the first step towards prodding people to invest in developing the vaccines. If people are convinced that chlamydia pneumonia just causes, some respiratory tract problems, people aren't that interested in making a vaccine. If they think it's going to save a third of the lives in a generation, which is, what we could expect if it's a major cause of atherosclerosis and Alzheimer's and multiple sclerosis, then people are much more inclined to make the investment. And so I think all these things are interrelated. We have to understand the potential role in order to invest in finding out whether the infectious agent is really causing the problem, and then also to motivate people to make the investments in things like vaccines. Lewis Thomas, who's always a very insightful observer of science and medicine, talked about this a lot. He talked about how it's important to distinguish the decisive solutions from the sort of stopgap Band-Aid solutions. And he liked to use the analogy of polio. We spent a lot of money on iron lungs and massage therapy, and it didn't do all that much good. The damage was already done. The people's lives were already terribly compromised by that point with paralysis. And the decisive solution was making the polio vaccine. And now we just don't think about the problem of polio, at least in wealthy countries and most places in the world, because we've got the decisive solution in place, and that's so much less expensive per individual and for society that now, polio is not a healthcare cost for most countries, for almost all countries. In fact, it's a very minor healthcare cost just in terms of vaccine costs.
And you see a day when we could treat cancer in much the same fashion.
Well, we're already doing it. We're already doing it with liver cancer, and we're already doing it with cervical cancer and head and neck cancer because we have the vaccines already. It took a while to develop them, but that development can be speeded up. I mean, this is one of the stories of AIDS, is that once we recognized that HIV was playing a role, we realized that virus was important in causing AIDS. Then the old procedures that were causing development of anti-infective compounds, like antibiotics, antiviral compounds, to be so drawn out was shortened because people were saying, look, we've got a much more urgent situation on our hand. A lot of people are dying. Their lives might be improved. And we should try to accelerate this development, even if it means that there's a little bit more uncertainty about safety. It's important to accelerate. And so I think we have maybe have a different mentality which accelerates the development of these vaccines. But, another virus that looks like we know is involved in many cancers, probably involved in more than we know, or that we at least accept, is Epstein-Barr virus. This is a virus that most of us have gotten early in life, and it's now accepted cause of some cancers, and it's a suspect in others. It's present in some studies, at least, in about half of breast tumors and very few samples of adjacent tissue from the same woman who had the breast cancer. And so people are arguing a lot about this, and some people are not finding it, other people are. But when you get that kind of discordance in information, it's really important to resolve it and not just say, well, half of the studies don't find it, half do, so there's nothing there. You have to ask, well, why would several labs find it in breast cancer tissue and not in normal tissue, whereas other labs wouldn't? And I think one of the best explanations for that, certainly one worth pursuing, is that the techniques are a little bit different, and some techniques are a little better than others.
The take-home message for our listeners, Dr. Paul Ewald, whether it's cancer or chronic conditions like multiple sclerosis, schizophrenia, or asthma?
Well, I would say that recognition that infection has been more important than people thought, and infection is likely to be much more important than people think, tells us that not only can our society be investing more in trying to combat these infections and thereby have a much bigger bang for our buck of investment, but also that people are empowered, because many of these infections people can actually avoid, not just by behavior. It turns out that almost all of the cancer-causing viruses of humans are caused by pathogens that are transmitted by kissing and by sex, and then a few other routes, like sometimes by milk and sometimes by contaminated needles, contaminated blood supply. And so once you know this, then people can make decisions that reduce their exposure. So a person who knows this might first of all, decide to get a vaccine, such as the human papillomavirus vaccine, and that's an empowering decision they can make. They also might decide to have fewer kissing partners or fewer sexual partners, because it looks like the viruses that are likely to be involved in causing not just cervical cancer, but other cancers are likely to be transmitted by saliva and also by sexual contact. And so this is quite empowering. Even though we won't know the full story for another 10 or 20 years, what we know now suggests that altering behavior can actually reduce your chances of getting a disease that could kill you.
Dr. Paul Ewald, thank you so much for talking with us on the People's Pharmacy today.
Well, thank you. It's been a pleasure.
You've been listening to Dr. Paul Ewald, Professor of Biology and Director of the Program on Disease Evolution at the University of Louisville. His books include Controlling Cancer, A Powerful Plan for Taking on the World's Most Daunting Disease, and Plague Time, The New Germ Theory of Disease.
Lynn Siegel produced today's show. Russ Henry and Al Wadarsky engineered the program. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Redix Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. 800-345-7339, online at uttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 906. That number again, 800-732-2334. Or you can place the order on our website, peoplespharmacy.com.
On our site, you can let us know what you think about today's show and share your own story. You can also check out our books and informational guides. At peoplespharmacy.com, you'll find answers to your questions about common ailments, prescription medications, herbs, and home remedies.
You might also wish to sign up for our free online newsletter or the free podcast of the show. You need never miss another People's Pharmacy program again. You could also share it with a friend. It's all there at peoplespharmacy.com.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks very much for listening today, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to the People's Pharmacy.